Please stand by. We're about to begin. Good day and welcome to the ASTHO's Peer Assessment Project Overview conference call. Today's call is being recorded. At this time, I would like to turn the conference over to Ms. Jennifer Lumpkins. Please go ahead, ma'am.
Thank you so much, Carrie. I really do appreciate it. So just to give you a heads up, here's the agenda for today's call. We're going to have some brief opening remarks from ASTHO, brief opening remarks from the ASPR Hospital Preparedness Program, background on the initial tool development, overview of ASTHO's peer assessment project, both the process and the tool development, a summary of our peer assessment trip to Florida, and some key lessons learned and key takeaways from this process. So again, good afternoon and thank you for joining the Association of State and Territorial Health Officials Peer Assessment Project webinar, co-sponsored with the Assistant Secretary for Preparedness and Responses Hospital Preparedness Program. I would like to thank my colleagues from ASPR for providing ASTHO with the opportunity to support this project. I would also like to thank all of the Florida peer assessment participants for their time, effort, and willingness to share their experiences and professional expertise, which greatly informed the contents of the report that you'll see later on in this webinar. Special thanks to Bruce Clements, who's the Director of Texas Department of State Health Services, Health Emergency Preparedness and Response Section, and Michael Lair, the Chief of Emergency Preparedness and Response at Washington State Department of Health, for their willingness to serve as peer assessors for this project. Additionally, ASTHO would like to recognize the Florida Department of Health, specifically Cindy Dick, who's the Interim Director of Emergency Preparedness and Community Support, and Christy Luce, who's the Chief of the Bureau of Preparedness and Response, for their outstanding support and assistance in planning and conducting this peer assessment. The purpose of today's webinar is to provide you with an overview of the peer assessment project, including the development of the peer assessment tool, a summary of the process and the trip to Florida, and to provide some key lessons learned and key takeaways. So now I'd like to turn the program over to Melissa Harvey, the Director of National Healthcare Preparedness Programs with the Office of Emergency Management at ASPR, to provide her opening remarks.
Thank you so much, Jennifer. About 5 years ago, the Department of Health and Human Services Office of the Assistant Secretary for Preparedness and Response commissioned the RAND Corporation to work collaboratively with community stakeholders to develop a tool for learning lessons about federal policies and guidance through the lens of responses to mass casualty incidents. I want to make sure it's very clear that the purpose of this tool is not to conduct after-action reviews following emergencies. We know there are plenty of those out there. This tool, which was initially called the Peer Assessment of Preparedness Activities Tool, is to use responses as a way to identify the preparedness activities that are most effective in contributing to a successful response, not at all to evaluate the community's response. The ultimate goal is to use these lessons to identify opportunities for improving federal guidelines and preparedness. The tool is designed for use by peer assessors from other communities that were affected by mass casualty incidents to promote an open discussion of issues and spread innovations among communities. So we did this tool back in 2012, and unfortunately, piloted it twice. The pilots were wonderful, both in West Texas and Boston following the marathon bombing, and certainly we hoped that those incidents would never have occurred. But unfortunately, since they did, both incidents gave us an opportunity to pilot this tool to, again, look at preparedness activities that are effective to contributing to a response, not the actual actions of the response. And I'll certainly leave it to Bruce Clements to talk a little bit about his experience having the tool used in West Texas and how that worked with the peer assessors from Boston. We also used the tool one other time following the Amtrak train derailment outside of Philadelphia a few years later. And at that time in ASPR, we were really thinking about how do we use this tool to a bit more broadly. We knew it wasn't really going to be feasible to have RAND go out with ASPR every time we wanted to use this, but more use it for perhaps even local emergencies that might not be well known because they didn't reach national attention, but to have it be used more broadly. And we thought there was no better avenue to do that than to engage ASTHO to work with the state directors of public health preparedness and the healthcare coalitions to begin to use this peer assessment tool more broadly. So again, we were about a little over a year ago confronted with another very unfortunate incident through the Pulse nightclub mass shooting, and found that that might be another unfortunate incident to use a tool like this to learn about ways in which preparedness activities contributed to the response, and also help us here in the federal government develop better guidance and better ways to target our guidance that would help to close those gaps in preparedness going forward. So I will say ASTHO did a phenomenal job convening its a subgroup of the directors of public health preparedness and coming up with a concept of operations on how to use this tool, and recruited, as you heard from Jennifer, Bruce Clements and Michael Lehrer to go to Florida and to really be the ones to spearhead the latest use of this. And we wanted to have everybody on a webinar to share with you what that looks like, with the hopes that you'll have a desire, perhaps, if there's ever an event in your community, to use this peer assessment tool and, again, learn from it in the same ways that the last 4 times it's been used, those communities have learned as well. So again, thank you so much to Jennifer Lumpkins and the ASTHO staff, as well as those directors of public health preparedness who had a hand in really taking this tool to the next level it is today. And you'll hear a lot more about what that process was like in the subsequent discussion on this webinar. So with that, I don't want to take up any more time, but I want to introduce Bruce Clements, who's the director of the Texas Department of State Health Services Health Emergency Preparedness and Response section. So Bruce, I'll turn it over to you.
Thank you. I appreciate that, Melissa. And you provided a really nice backdrop for me to launch into how we developed the tool initially. Go ahead, Jennifer, if you could advance to the next slide, please. So when this first started, it was about a 1-year project from June of 13 to June of 14, and it was through a contract with the RAND Corporation that ASTHO funded. Initially, they spent the first several months going through doing extensive lit reviews and looking at previous mass casualty incidents around the world, and kind of learning all that they could from that, and then also looking at after-action reports from previous incidents that occurred around the United States. There was a peer assessment advisory work group put together, which was comprised of folks from Boston and Texas. And then also there was a review of previous post-incident evaluation tools that were similar in that you go in afterwards and try to assess how a response went overall. But again, the focus not being to repeat the AAR, but rather looking at our programs through the lens of the response, or vice versa, looking at the response through the lens of our program. So in other words, instead of asking questions like what went right, what went wrong, asking more questions about what contributed to the response prior to, what kind of exercises did you do that contributed, what kind of training did you do, what activities related to your program contributed to the success of the response, and also what throughout the response was highlighted that could possibly be addressed by our preparedness programs in the future. So after doing a literature review, kind of gathering all the facts of all the related tools that were out there, and also putting together an advisory work group, the group launched into 2 pilot tests, the first one being Boston and the second one being West. So in December of 2013, we conducted the Boston Marathon bombing peer assessment, came back and revised the tool, and then in April of 14 went to West Texas, completed that visit, and then revised the tool again. So after the period of 1 year, we had put together that final tool by June of 2014. Next slide, please. And this is the peer assessment advisory work group. There's an interesting story behind kind of how all this really got started. First of all, the Boston bombing, when that occurred, it was actually 54 hours from the time of the Boston bombing till the time of the West Fertilizer Plant explosion in Texas. So there's a 54-hour, just over 2-day period of time that expired. And right after the West explosion, about the day after that, there was the big chase and the lockdown up in Boston. And it just so happened that Dr. Nikki Laurie and Mr. Rich Serino, Deputy Director of FEMA, they were locked down in a hotel in the same place. And they had an interesting discussion about, wouldn't it be interesting to have the folks from Boston visit Texas, and have the folks from Texas to visit Boston, and try this peer assessment process, both of them using kind of the backdrop being an explosion that occurred. Now very different in terms of location, one urban versus rural, one in a heavily crowded area versus a not so densely packed area, and to look at how the program, the preparedness programs, contributed to those response activities, and what could we learn from that. So those two actually launched into, Dr. Laurie and Mr. Serino launched into kind of that initial discussion of wouldn't it be interesting to use these two locations as the pilot test, and that's what happened. So the rest of the membership of that group you can see listed there, and it's a combination of folks from Boston and from Texas as well, with some great support also that we had from Greg Margolis from ASPR. He did a great job kind of herding the cats through the whole process. Next slide, please. And so as I mentioned, the Boston bombing occurred on April 15th, and the West Fertilizer Plant explosion was 2 days later on April 17th, 54 hours later. We did the Boston bombing peer assessment was done 8 months after the bombing, versus the West Fertilizer Plant explosion peer assessment was done just about 1 year. It just fell just over a week shy of being the 1 year anniversary, which, by the way, that is a bit problematic, and I'll go into that in a little bit more detail in here in just a moment as far as what the timing of these kinds of visits should be. Next slide, please. And as Melissa alluded to earlier, there were two other instances where this tool was used. The Amtrak train derailment in Philadelphia in May 12th of 2015. Then the peer assessment of that was done 9 months later. And of course we had the Pulse nightclub shooting in June of last year in 2016, and the peer assessment was done January of 17, so it was 7 months. And really what we found through that is that time frame that ASPR and ASTHO agreed to do these other peer assessments appears to be pretty much an ideal time frame, and you get like 6 to 8 months, somewhere thereabouts, post-event, but avoid coming up on the 1 year anniversary. That's a pretty good time to go in and do this particular type of an assessment. Next slide. And the peer assessment tool development, it was a really simple process. I mean, everything about this is, although a lot of what we glean is pretty complex programmatically and technically, but the process overall, it's a really simple process. It was just a matter of reviewing all the information that's out there and having initial discussions with some of the folks in that community, and then actually visiting the community and conducting interviews with the different stakeholders that were involved in the response and different responders. We started off in Boston. We did both some one-on-one interviews as well as group interviews. And we also in Boston we cast a broad net and included law enforcement. We had a meeting with the police commissioner and his senior staff. There were discussions about whether we should include bystanders in some of these initial interviews and discussions. And what we found through the Boston visit is we needed to kind of scale it back and really focus like a laser beam on ESF8, with some emergency management involvement as well, but not involving all these other response organizations, but to really focus in on public health and healthcare, EMS and hospital, et cetera. So we visited the communities and conducted those interviews, and it was also, I think, important in each instance that we went and visited the site. So the sites were visited by the team, and details were kind of explained and laid out, giving you all the context, and you could kind of see the lay of the land and where things were staged. From where you were at, you could kind of get an idea of, okay, here's how the response actually looked on the ground, and then sit down with the folks doing the interviews and start asking some really basic open-ended questions about how your program influenced the response, and preparing your briefing from that. Next slide, please. And again, I mentioned a couple times the timing. The timing is really, really critical to this. And as you've seen, we had the Boston Marathon bombing 8 months, the West Fertilizer Plant explosion 12 months out, and that was a sore spot. We didn't really realize going into it. It's just the way that the schedule seemed to work out as we were moving toward doing the West Fertilizer Plant peer review. And we were coming up on the 1 year anniversary, and you could tell that there was some tension and some real sensitivity around the issue, because as we were approaching the 1 year anniversary and there were memorials and other things being planned, the individuals who we were speaking with were, it was just a time when it was coming back fresh to them again, and that's why really the timing of this is essential, in that if you wait too long, then two things can happen. One, you can be approaching the anniversary. Two, you get too far out and people start forgetting a lot of the really salient points that you could draw out of them otherwise if you do it a little sooner. You also don't want to do it too close to the incident, because if you come in just weeks or a couple months after and the AAR process is still underway, then asking them these kinds of questions while they're already answering similar questions is also not really an appropriate approach. So finding this kind of nice balance of not too close to the incident but not approaching the 1-year anniversary is kind of what we've learned from these initial peer assessments that we've done in these 4 locations. Next slide, please. And here's some of the things that we learned from, this is just from the initial peer assessment tool development. First of all, I mentioned this before, the assessment really has to focus tightly on ESF8, Public Health and Medical Services, and not stray too far outside of there. Now the one kind of exception to that is there are things that ESF8 winds up getting pulled into that are not specifically ESF8 missions, but a lot of times ESF8 is drawn in anyway to support other emergency support functions, and we saw that in the Pulse nightclub response as well. But to really focus in on ESF8 primarily, and also that focus should be on preparedness and pre-event activities, not repeating kind of what happened, the AAR process and what went right, what went wrong, but really looking at what did we do prior to that contributed to the response, what can we do now that we've done the response that we can change up in our program to address gaps that may have been identified. So it's a really different perspective than just doing the AR. And it really does, when you sit down and go through this process and you talk through a response with someone, it really brings out the value of our preparedness programs. And this is one of the really most valuable pieces of this entire process, is that if you can sit down and glean from current events from individuals who were on the ground responding and say, well, here's how our preparedness program contributed to this response, it really creates some valuable lessons learned through the perspective of the programmatic side of it that can be used to support our program for leadership at our local, state, federal level to explain to leadership the value of the program and put it in context of recent events and recent responses, which is extremely valuable. And also using peers provides a lot of flexibility. If you have an experienced preparedness professional who's been on a lot of ESF8 related responses, who can kind of ask some of those broad questions about, well, how did exercises, for example, contribute to your preparedness for this? Well, then as they're talking about that, there might be some small piece of this that now that person who is doing the peer review has read some of the AARs and some of the previous information, and now they're talking with the responder, they can really bring out, by asking some probing questions, additional information like, well, what kind of exercise was that? Who participated in that? What were the major findings of your exercise, and how did that really change the way that you did your planning subsequent to that? So it really brings out a lot of extremely valuable information to have peers who understand the programs, who have the experience, and can kind of follow on with the probing questions to glean more information from that. And so, like I said, a lot of really valuable information for local, state, and federal partners and policymakers. And so, from that standpoint, it's an extremely valuable process. There's also been, I know Melissa and I have discussed this before, I think there's also probably some value in, at some point, having peers come during the incident, not during acute incidents like the West Fertilizer Plant explosion. It's just moving too fast. But if we have a hurricane in the Gulf, for example, to have other preparedness professionals come in and not to participate in the response, but to sit back in our medical operations center or some other location and just observe what's going on and look at this, look at the response through the lens of the program and what's the program doing to, what capacity did the program build that's being brought to bear right now as they ramp up for this response. That could also, I think, glean a lot of additional really in-depth information. So that's the backstory of the initial peer review assessment tool development. And so with that, I guess I'll turn it back over to you, Jen.
Thanks, Bruce. I really appreciate that. So I'm going to give you guys an overview of ASTHO's peer assessment project itself. So just as a little bit of a background, ASTHO did receive a cooperative agreement from the Assistant Secretary for Preparedness and Response for the purposes of creating a peer assessment team to identify the impacts of the hospital preparedness program on a series of different events or responses. So with that, in order to carry out this project, we wanted to identify a group of individuals to help us out with this process. So we convened a group of 6 preparedness directors about 3 to 4 times to help us really develop the overall concept for the peer assessment team, which was formerly called the Response and Recovery Strike Team. And then we came to consensus on some of the following things. We wanted to make sure that we developed a peer interview tool to capture information on the impact of the hospital Preparedness Program on key response activities. We also wanted to be able to provide input onto the concept of operations for this project and for the group, as well as the tool. We wanted to identify that the group would then serve as peer interviewers for the purposes of the project, and then they would also help assist in writing some of the report write-up to make sure that the information is both accurate and constructive. So a little bit about the peer assessment tool development. So it was a two-phase process. So we had phase 1, phase 2, and then our pilot test. So I just want to briefly talk about phase 1. So an initial version of the peer assessment tool was developed based on a series of literature reviews of other tools that were developed to capture information on past domestic mass casualty incidents and previous post-incident tools developed by the RAND Corporation, Georgetown University, all of which you can see laid out here on that slide. So that was the first step. Phase 2, we had the peer assessment team was brought together again via webinar twice to review the peer assessment of preparedness activities tool, which is the RAND tool, and determined that this really needed to be expanded to capture more of the impacts of the hospital preparedness program by just adding a few questions. So not that you can fully see the questions on here, but this gives you a snapshot of what the peer assessment tool looks like. It's about a 2-page tool. So just to give you a little bit of a background, there's intro questions about the jurisdiction. We ask questions about the challenges, the successes, and really we try to focus on the activities, just like Bruce mentioned, that contributed to both the successes of the response and as well as the challenges of the response. We decided to expand that question a little bit out, so there's several probing questions in there to capture particularly how some of the hospital preparedness program capabilities impacted their ability to respond to this particular event. A couple other things that I wanted to mention is that this process, we had step 1, which was like to develop this initial summary. Step 2 was site visit and preparation, which I'll get to in the next slide. And then step 3 is developing that final summary, which you probably have downloaded already from the ASTHO website. So moving on. To the Florida peer assessment trip, which happened in January of 2017. So we had our peer assessment team consisting of Bruce Clements from Texas, Michael Lair from Washington State, myself. We had our Florida Department of Health staff that really helped us kind of coordinate this effort. And then special thanks to the Central Florida Disaster Medical Coalition members who really were the ones that we interviewed over a 2-day period. So now I'd like to turn it over to my colleagues Michael Lair and Bruce Clements to share some of their experiences during the actual peer assessment trip in Florida to capture lessons learned from the Pulse nightclub shooting.
Thanks, Jen. This is Michael. Hello, everybody. You can go ahead and advance to the next slide, Jen. So what I'd like to do is just share with you a couple things. One is, as you can see, key learnings that the assessment team gathered from being with our colleagues in Florida. And I just really want to start off by thanking all the folks that we met with after going through such a traumatic incident and a really challenging response. To be able to take time and sit down with us and really open up, I think was incredibly valuable for me personally and professionally, and I hope it becomes valuable for all of you. So I want to share with you some key things that we learned from our colleagues. Not going to go into what you'd find in necessarily an after-action report. As was mentioned before, that's really for the organization or for the jurisdiction to learn from their incident, but really some key things that I think we can all learn and gain from. And then I want to talk a little bit about the assessment process itself and what we learned from that, and maybe how we can improve it in the future. So first of all, the main thing that stood out for me, without a doubt, was trust. Trust among response organizations is absolutely essential, and when it's there, it really shows during a response. And when it's not there, it also shows. Having trust really enables access to resources, access to expertise that your partners have. It opens up awareness of what's around you, what resources are around you. A lot of comments came that folks knew around the region, local agencies, what existed that they could use in this event just because of the trust that they had with their colleagues, that it was a phone call away, and that's all that they needed. Where trust wasn't in place, I think it hindered a lot of the responses, what we heard, and I think it ties to a lot of the things that what really Central Florida focuses on, this area, this Central Florida region, day to day, and that is intense planning, training, and drilling together. And so at the local level, trust was really solidified. But when you engage, for example, federal agencies coming in and interacting with locals where they don't really train and drill together, there wasn't that familiarity and there wasn't that trust. And so it was a very clear delineation there that I think pointed out, one thing we may need to work on quite a bit across the country is how do we build trust among what we may call non-traditional partners. Secondly, we all incorporate assumptions into our planning. That's normal. That's a standard thing. But we do need to avoid traps. It's easy to get into planning around your assumptions. I think H1N1 in 2009 was a great example. How much notice are we going to have before this hits our jurisdiction? Well, we didn't have nearly enough. In this situation, the proximity of the incident to, for example, the level 1 trauma center, the time of day that it occurred at 2 o'clock in the morning, all of these things really either helped or hindered the response in certain ways and affected things like notification and the ability to get folks mobilized quickly. And so we need to have assumptions in our planning, but we need to sort of test them and validate them and then ask the question, what if it doesn't unfold the way we might be thinking? Do our assumptions hold up? And more importantly, do our plans then hold up? Third, this one really gave me quite a surprise, and it really sort of made me step back personally and professionally and think about where I stand in this, and that is that some response capabilities just may be too big a lift for local agencies or even regionally. We sort of have delineated, what locals are going to do, what states are going to do, what the feds are going to do, what we're going to prepare for, and how we're going to respond. And there's obviously the national framework and all that. And we all have a pretty good understanding. But when something then happens, and I consider Central Florida to be one of the most, if not the most prepared region in the entire United States. I mean, they take preparedness unbelievably seriously. They invest huge resources, not just federal grant resources. They drill relentlessly. They train. They plan together. They have incredible partnerships. And even they said that when it came to, for example, the family reunification function during an event like this, which is critical, and it is an absolute, standard that has to happen, that was even too difficult for them. Now, they pulled it off. They did a great job. They pulled partners together, and they made it happen. But several folks said, this was something that really shouldn't be done at the local or regional level. Maybe this needs to rise up to a higher level, at the state level. And so if for me, if the most prepared area of the country, or one of the most prepared areas of the country, couldn't do it, it sort of gave me an opportunity to look back in my own state and say, well, maybe we need to rethink our assumptions about what preparedness activities occur at what levels. And so that was a good learning for me, where that perspective from these peers really opened up some eyes. And finally, as I mentioned, drills. We all do exercises. We write after-action reports. They're really for our own benefit. We say communications is a problem, and then we develop an improvement plan, and we go back to preparedness. I think Central Florida does it very differently, and we all can learn a lot from this. They drill intensely, frequently. The drills are very realistic, and they are incredibly challenging. I mean, they're not fun. People don't come out looking great. They move hundreds and hundreds of patients during each drill, and simulated patients, or not real patients, but they're people that they're moving, and that is of great value. You really want to drill to break what you've got so you can rebuild it in a way that will work better. And I think, I appreciate ASPR going in this direction with the HPP program. We need to look at that even more intensely, I think. I think the reason trust is there, I think the reason there was so much efficiency and proficiency during this response was that, these colleagues of ours drill relentlessly, and they do it in an incredibly collaborative way. So that was a key learning for me as well. Go ahead on the next slide, Jen. And so a bit about the process. Bruce mentioned some key things from the other incidents that involved an assessment process. A couple things that we learned. One, having peers actually conduct the assessment is essential. You can bring in, your funders or say a university to do an assessment, but the relationship is very different in those circumstances. It's not necessarily worse. It's just a very different vibe. And when you have a trusted partner across the table, trusted in the way that they know what you've been through, and they work on the same types of things, you can instill that sense of trust right from the beginning of the event, and people are willing to open up about what are going to be controversial issues. There are going to be some challenges, some concerns expressed, some opening up about failures that happened, and that really requires instilling that trust between the assessor and the folks that we're visiting. So it's really essential, I think, to the success of a peer assessment is to have folks who've really been there, and so I think that was a key part of this process. I think we talked a little bit about scheduling. Definitely after obviously after the AAR is complete. But also, not too far after. I mean, I think when we start scheduling this really should be towards the tail end of the incident itself, because we need to look at talking with a number of different people, and I'll get to that in a minute, but, really more than a half dozen people. And so just getting a calendar proved to be, several months delay in this incident. And ASTHO did a fantastic job of organizing and coordinating that. But I think we should start towards the end of the incident putting the feelers out to say, we would like to do this after the AAR comes out, 45 to 60 days or so after the incident, maybe 4 or 5 months after the end of the incident, we conduct that assessment. So it is fresh in people's minds, but it's not too far after where people have left or people, don't have the same recollection. So timing of the scheduling and coordinating the logistics is essential. Just getting that sweet spot is going to be something where we'll just have to work on. And it may depend on the type of incident. If it's a sudden incident that happens and then it's over, or is it something that's dragging out for months and months? I think third, the questions that we ask, really should leverage the experience in front of us. There's incredible knowledge and perspective from across the table. They know things that we don't know, but we desperately need to know. They can advise our funders on the value of how we are preparing. One of the questions we asked, we sort of, ad-libbed a little bit and say, how would you advise our funders as to whether or not, we're preparing in the right direction? Did the components of the National Preparedness Program actually help you in this event? And if so, how? And that's incredibly important, because they've got that perspective. They've got that knowledge now. Again, the AAR helps the organization or the jurisdiction, but the assessment process really helps the rest of us. And so, how we tailor the questions, I think, is incredibly important. How we improve those questions and make sure that we get at that knowledge and experience to help really our funders, to help improve the national program, and then to help the rest of us prepare. One thing we asked was, if you got a call today from one of your peers across the country who just experienced the same thing and they're activating and they wanted to know what are the 3 things you would tell them, to be ready for, or to avoid, what would you say? And, the answers we got were very informative and enlightening and I think very important. That experience is really invaluable. Fourth, we talked to several organizations, as you saw on that previous slide. There's the local ESF8 lead, state ESF8 lead, the medical examiner's office, the coalition executive director, the emergency manager for the trauma center that was 2 blocks away, the head of the state's mortuary response team, all these different perspectives in one-on-one meetings so they could give us their assessment of what happened, but also what they think is important, what they think is valuable, where we need to improve. And so that was really valuable for us because where we saw synergy between these comments, really sort of these points really sort of bubbled up and sort of stood out. So it's important, I think, not to just go in and talk to 1 or 2 folks, but really to get a diverse range of perspectives on what happened and what they think is important. And finally, I'd just say this has to be a core component of our national preparedness program. Nobody would do an exercise or go through a response and not do a hot wash, not do an after-action report or an improvement plan. I mean, that's standard practice now, and it just has to happen. This, I think, has to happen as well. Because, again, the AAR process is good for the individual, the organization, the jurisdiction, but how are we capitalizing on that experience and that knowledge and that perspective? We're really leaving it on the table if we don't have a standardized, sort of normalized peer assessment program where we can take a look at these types of incidents. And I really like what Bruce said about even coming in during a response, not judgmental at all. We're not critiquing at all. It's learning about how the rest of us can improve our national program, our state programs, our local programs, based on the knowledge, experience, and perspective of our peers. So with that, Jen, I think I'll turn it back to you. Or Bruce, do you want to jump in and add anything else?
Oh, no, you did a really good job covering all that. Just a couple of things, though. I think one of the most valuable things to come away with and through this whole peer assessment process is learning all kinds of innovative adaptations. It's amazing. We work on our capabilities, and we have our deliverables through the grants, and we have our planning, training, and exercises. But when you see how our program not only builds capacity to respond, but watch how that response capacity actually adapts to a given situation. There's so much to be learned from that you cannot really get from an AAR. It's really, if you have a person who understands the preparedness program sitting across from the person who just did the response, you can ask those kinds of leading questions or follow-on questions that will kind of get you those innovative adaptations, which I think are extremely valuable and really hard to find outside of a process like this. And that's all I have to add, really. I'll go ahead and turn it on back to Jen.
Thanks, Bruce. Thanks, Michael. I really appreciate your overview of the trip. So just I invite you all to download the Peer Assessment of Preparedness Activities Impact on the Public Health and Medical Responses report. This is a summary of what we did in January of 2017. So I really do invite you to take a look at this report because it really includes a lot of different information, including the background on the Pulse nightclub shooting incident, the response challenges, response successes, the preparedness activities that supported the response, unplanned adaptations, preparedness lessons for other communities and states, key lessons learned and takeaways, the impact of the HPP program on the response, and recommendations for additional needs that the hospital preparedness program and other programs could address. So I really do invite you to take a look at that report, as we're not going to go delve into it right now. But really when you get a chance to download that and really do take a look at that. So just to kind of close the session, I wanted to talk about some of the key lessons learned throughout the process that have already been discussed by Michael and Bruce. So obviously, timing of the peer assessment is key. The visit has to be at the right time, and anywhere from 7 months out from the event to 12 months out, it really has to be the right time. And obviously, you want to steer away from the anniversary of the event, if at all possible, because you don't want it to drum up any negative feelings for the peer assessors that you're going to be interviewing. And secondly, I think the jurisdiction itself really gains an opportunity to share their story, which I think doesn't happen as often. And also, this allows their peers to hear their story. And hearing and telling that story and repeating that story, I think, is really important. Thirdly, I think the peer assessment team, and I think we talked about this before, we want to make sure that we request the after-action report to review prior to the visit, because this really helps many facets of the actual interview process itself. It helps you get some of the background. It helps you to look at your probing questions in the tool that you have to see if you have anything. And then finally, as Michael had mentioned, peer assessment visits should be scheduled within 30 to 45 days of the after-action report or an interim report that's created if it's unavailable, because this is really key, again, to have ahead of time. And again, looking at all the schedules as we had to do with our Florida peer assessment trip. So those are the big key lessons learned and key takeaways that we got through the process. So I want to thank everybody for joining today. Before we turn it over for Q&A, I just want to thank our colleagues from ASPR, Melissa Harvey and her team, for really providing the support to ASTHO for this project. And I'd really like to thank Bruce Clements and Michael Lair for their support and for them to actually be part of the peer assessment process and the review team. So with that, I will turn it over to Carrie to open it up for Q&A.
Thank you. If you would like to ask a question, please signal by pressing *1 on your telephone keypad. If you're using a speakerphone, please make sure your mute function is turned on to allow your signal to reach our equipment. A voice prompt on the phone line will indicate when your line is open. Please state your name before posing your question. Again, press star 1 to ask a question. We'll pause for just a moment to allow everyone an opportunity to signal for questions. And we'll take our first question from...
Hi, this is Beth in New York City. Thank you so much for this presentation. Just a quick question. What is the vision for this moving forward, and who would that peer assessment team be, and how would they be dispatched, and what's the vision there?
So Beth, this is Jennifer. I can take the first part of it, and I'll surely allow Bruce and Michael to chime in, and or Melissa. So I think the vision for this is to look at this as an opportunity for other jurisdictions to partake in this process, post-event or during event, as Bruce had indicated. I think that's the long-term vision, is to be able to use this tool in for multiple opportunities. As far as, and of course, with the resources that we would need. So that really depends on the resources that we have. But I think to answer the second part of your question, the peer assessment team would be comprised of preparedness directors across the country to actually go in to be peer assessors and to ask those questions. And that's really the long-term vision for this, because we found that using peer assessors really enables the conversation to be more robust. So we're not looking, it wouldn't be, we would be asking for like universities or other entities to come in, but that's the long-term vision for this particular peer assessment project.
But would that, sort of, but so suppose something happened in Kansas, would ASTHO or ASPR ask for preparedness directors to sort of see who was interested in being part of a team to go there and do the assessment?
I think we would certainly entertain that. We also have a peer assessment team that we brought together that's already consisting of about 6 preparedness directors. So we'd probably go to that team and maybe expand based on the incident.
Okay.
Yeah, so we would go back to the team and see if they wanted to do that. And then we would expand that team to incorporate other folks, so we had some more depth on the bench in case there was, say all 6 couldn't go to the event for, or post-event.
Oh, and this is Bruce. Just to tag on one quick comment to that, Beth. I think it's also important to, in the future, to seek out those who have common response experiences. I mean, unfortunately or fortunately, most of us don't have explosions and mass shootings under our belt, but that was actually helpful between the West and Boston exchange to have people with some common experience. And so, for example, the Kansas tornado example, to send somebody like a Scott Sprout from Oklahoma up to Kansas, or someone from Missouri to Kansas, someone who has response experience for tornadoes, or if it's hurricane, to have someone from Florida come to Texas. I think that's really valuable to have people who have done very specific planning, training, and exercising, and in some cases have response experience for kind of like events.
That makes a lot of sense, and it might be worth considering like a bank of sort of people who would be appropriate for certain types of, who'd be appropriate and willing for certain types of events, like these people for hurricanes, these people for tornadoes or mass shootings. I mean, unfortunately, we have more and more experience with that, so I think that would be really useful.
Thanks, Beth. We really do appreciate that. And I think the idea is to develop a bank or to create a bank of preparedness directors that could do that. And I do like the idea of going by people with those with certain experiences, so as Bruce mentioned. So we'll definitely keep that in mind as we move forward with figuring out what our next steps would be for this. So thank you for that.
Once again, if you'd like to ask a question, please press star 1. And we'll take our next question from...
Line is now open.
Good afternoon. This is Sherry Adams.
Hi, Sherry.
From Maryland. I have a question. This is a really interesting process, and I had already downloaded the report from the Pulse nightclub incident and found it really fascinating reading. I have a couple of questions. One is clearly on the report, you didn't differentiate necessarily between FEP preparedness and HPP preparedness. it was more of the holistic approach to all of the preparedness activities that went on, which I think is useful. Mm-hmm. And two, will any of this data be used to drive any of the funding decisions? Because I would think this would be really helpful as you move forward to look to see where some gaps were consistent and maybe use that to drive some of the funding.
Hi, this is Melissa Harvey. I'm happy to take that last part. That was the ultimate one of the ultimate reasons for developing this tool. Obviously, we'd have to use it more than 4 times to be able to get enough data to really figure out where we want to drive funding and activities, so that it wouldn't just be in, for the most part, similar incidents across the U.S. as well as, because other than West Texas, relatively similar locations. So, but ultimately, if we can get enough of these done, where we would feel comfortable saying that across the board, these generally are the gaps or where preparedness has been helpful, that we would love to use it to drive kind of federal guidance and funding decisions. Sure.
Can I ask another question?
Sure.
God, that scared me, and I just lost the thought. Recovery wasn't one of the things that was necessarily covered. So is there some thought of adding recovery sort of assessments at certain periods of time, going back to those same places and seeing what recovery was like? Because I know for us, we've got a recovery plan. We're struggling through trying to validate it. So I think that would be useful information as well.
Thanks, Sherry. Yeah, so in the original version of the tool itself, we didn't have any recovery questions, but that you raised an excellent point, and I think that's really important to take back to the team and to see how we can intertwine that into the tool itself. And maybe after we visit the location, then maybe we follow up, a few months later, whatever that time frame looks like, to actually get some of those, looking more at recovery. So that's really a great point. That's something that we probably hadn't considered, just because we were really trying to focus on the incident itself and some of the preparedness activities that lended to the successes and the challenges of the event. So thank you for that.
And it appears there are no further questions at this time.
Okay. Well, then I think if we don't have any other further questions, if you can see that you see my contact information. So if you do have any additional questions about this project or process, or you just had a burning question after this, you can feel free to email me or call me. The information is provided on that last slide. So I guess this would conclude today's webinar. I just want to thank you all for joining today. And just as a reminder, this was recorded and will be posted probably within the next month. So we'll be sure to share that link out with folks so that you can download that and listen to it at your own leisure, and share that with your other stakeholders in your organizations. So I just want to thank you all for joining today. So that does conclude today's webinar.
This concludes today's call. Thank you for your participation. You may now disconnect.